You're listening to episode 12 of A Whole New You podcast. On today's show, we're discussing the importance of gut health with Lahana Vigliano, a certified clinical nutritionist and owner of Thrival Nutrition. Welcome to A Whole New You podcast. I'm your co-host, Kim Maravich. I'm a registered nurse and author of the book 360 Health. I'm joined by my dear friend, Lori Biddle, a health and wellness coach certified through the Institute for Integrative Nutrition. Our show exists to inspire and empower women to take charge of their health with weekly tips and conversation about self-care, mindset, nutrition, fitness, and clean living. Please keep in mind that the material provided in this podcast is intended as general information only and should not be used as a substitute for professional medical advice, diagnosis, or treatment. We're thrilled to have you here. Let's get to the show. Welcome back, everybody. Today, we have Lahana Vigliano of Thrival Nutrition joining us, and I'm thrilled to have her. Lahana and I met online, I guess you could say, about a year ago. I was on Lahana's podcast, which is the Thrival Nutrition podcast, and I was a guest on her show when I was promoting my book, 360 Health, and she was so sweet and such a kind host, and I reached out to her to see if she would be on our show, and she so graciously said yes. So I'm thrilled to have Lahana here. I'm just going to read a little bit about her, and then we'll get into our interview. So Lahana Vigliano is a certified clinical nutritionist and owner of Thrival Nutrition. She specializes in helping women who struggle with weight loss, hormonal imbalances, digestive issues, and chronic fatigue. She creates tons of free resources on her website to help women feed their families healthier with real food recipes, blogs, and podcasts. Outside of her love for nutrition, she is a mama of two and a wife. You can connect with her over on her blog at thrivalnutrition.com. And her Facebook and Instagram, which is also Thrival Nutrition. So welcome, Lahana.
Thank you, Kim, for having me. I'm so happy to be here.
Yeah, thank you. I love you so much. And I actually was just listening to your latest episode of your podcast this morning. And you have so many just really neat and interesting guests, like all different kinds of health. I was listening to the one today about clean beauty care products, which was really interesting. And then I think last week's it was really interesting. It was about how not to be a yeller as a parent. Yes. And I thought I need to listen to that because
we all need that.
I know, because God knows life with toddlers sometimes can be pretty trying. So, but
definitely.
Yeah, but your podcast is amazing too. So today's episode, everybody, is going to be about gut health. Lahana is very knowledgeable on the subject. But before we get to talking about gut health, I wanted Lahana just, if you would tell us a little bit about how you started Thrival Nutrition, why you started it, and also what kinds of resources and services you offer.
Yeah. So I started Thrival about 3 years ago. And it's so funny because I tell people, like, when I was in kindergarten, I always said, like, I wanted to be a doctor. Like, I always wanted to help people with their health. That's just my MO. And so I went all through school with, thinking that, and then prepping for PA school. And when I was in it, I was, basically being taught, and not PA school yet, but just getting into the prereqs and stuff. And I was basically being taught, like, if someone has this is the pill you give them. And I just knew that that just was not what I wanted to do. I knew there was something so much more to health and prevention instead of just, treatment with pills. And obviously it always, has a time and a place. But for the most part, I know that the majority of illnesses out there, especially the chronic diseases like heart disease and diabetes, and you name it, they are so preventable, or even like just giving your body the raw vital nutrients and ingredients that it needs. Your body can do its own little healing process inside. So that's kind of what brought about Thrival Nutrition. And then like 3 years ago, I first started with just blogging and podcasting. So yes, my thing was like dipping my toe in. I was still at home with my daughter. And so I just wanted to kind of get a feel, put some stuff out there, but not just, jump into like the full practice right away. So, yeah. And so now here where I am, I'm in Austin, Texas, and we have 2 dietitians on staff. Now we help women all around the US, and we are, focusing, like you said, hormonal imbalances, digestive health, women that just weight loss. Women come to me usually just for a symptom, like I can't lose weight, or I have headaches all the time, or I bloat all the time, or I don't know, everything and anything. Headaches, I think I said. So everything. And so every time, like, you just kind of look at their lifestyle, right? It always dials down to, girl, look at your diet. Like, and so that's like the first part. Obviously, that's the foundation. But then we have to look at like your stress and your sleep and exercise, and just making sure, it's a whole body thing. Because you can definitely focus on nutrition, which is basically 90% of what I do. But like, there are things like stress that are so huge in influencing our health. If we don't actually take that into account, we can eat as good all we want, sister, but we're not going to actually, make good health strides to optimal health if, you don't address stress and sleep and all that other good stuff. So that's why I wanted to start Thrival and really create that holistic whole body approach.
That's awesome. And I really, I think you touched on some key points that I'm sure will come up in today's episode too. Especially, when we're thinking about our overall health, we do think of diet, but there are so many other things like stress. I think we take that for granted in our society, because I think we're all living under a lot of stress. I mean, that's just like the American way anymore. But it really can affect our health and our digestion too, can it?
Yes, which I know I wanted to touch on that a little bit today, as we talk about gut health, because yes, it influences so much more than we think.
Right, absolutely. And you touched on sleep too. So, yeah, I think it is a holistic approach. I know, Lahana, I was so excited to see that you're expanding your network too. I didn't realize that until I was listening to your most recent podcast that you actually have others on staff too. So I'm excited for you. So congratulations.
Yes, thank
On
you.
that. And you have some supplements too, or at least the
Yes.
multivitamin.
We have
Okay.
the multivitamin right now, but we
Yeah.
definitely plan to expand this
Yeah.
year. The next one being a stress supplement, actually.
Oh, nice. Okay.
And safe for
Yeah.
breastfeeding moms as well, since that's a very
Mm.
stressful time after having a baby and stuff. So that's our next one, but we definitely plan to have more, which is exciting because I do love having the control over quality and, my pickiness.
Yeah, absolutely. And it's nice to have something to refer clients to that that you can trust because you created it.
Yes, definitely.
So, yeah. So, we've had a lot of interesting questions from listeners and even, just from our own community that, weren't exactly publicized. But I think there are so many questions surrounding the topic of leaky gut. And it seems like that's sort of a buzzword these days. You have leaky gut and it can lead to this and that. But I think, perhaps we don't exactly know really what leaky gut is. We've heard the term, but could you explain to us what that term means?
Yes. So scientifically, if you're ever looking for studies, it's called intestinal permeability. And
Mm.
basically, inside of our gut, I like to call, I'm so used to, I don't want to say dumbing it down, but making it really simple for someone to understand. Because when I'm explaining this to
Yeah.
clients, I don't
Mhm.
try to get too scientific because they're like, what? Like, I just have no
Yeah.
idea what you're talking about.
We need to understand. Exactly. Right.
So
Okay.
I think of them, there are these tight junctions, and I think of them as like gates, and they're all alongside of our gut, inside of our intestines. And so these are great because they are supposed to open for the nutrients, and after all your food's been broken down, that is what helps absorb the things and bring it into the body and utilize it. But sometimes with quote unquote leaky gut or intestinal permeability, those gates are actually open, more so it can bring in undigested food particles, viruses, toxins. I mean, you name it, whatever that's kind of like lingering in the gut, it can come into the body and be in places that it's just not supposed to be, to keep it as simple as I can. So
Mhm.
that's kind of where the term leaky gut comes into hand, because it does kind of, it's not, the tight junctions aren't tight anymore. The gates aren't really closed. They're just open and they're letting everything in. And that's why a lot of people are attributing it to like eczema and autoimmunity and so many
Mhm.
other things in our health, because it does start there in the gut, because that's like where we first, well, not where we first interact, but kind of is how we interact with our environment, right? Because our digestive
Mhm.
system technically starts at the mouth when we chew, and then swallow, and then stomach, and then intestines, and then we excrete it. So that is where the foundation is like, if you can't digest properly, or if you have underlying infections or whatever else in the gut, nothing else will kind of come into place. And I know we'll talk about hormones and how
Mhm.
that's connected as well, but that's the basics of like, what is leaky gut.
Okay. And you had mentioned, infections and inflammation. So, is the do you, in your understanding, is the cause of leaky gut due to like the food that we're consuming, or is it stress, or is it like infection, or is it a combination?
It's so hard because it's
Mhm.
a combination, and no one will really know. I don't feel like we'll know what really caused their leaky gut, right? Because, like you
Yeah.
said, there's food, which is honestly a main thing. I feel like that's probably the most majority, is that like we're eating not enough real food, too much
Mhm.
processed food, but stress also will. Because we have high cortisol, that's our stress hormone. When we have high cortisol, that dysregulates our immune system in our gut, because 75% of our immune system is in our gut. And so that's more susceptible to, having an overgrowth of candida or having gut issues and things. So stress definitely plays a role in that as well. Same
Mhm.
with just, I don't know, lifestyle factors, which I know I'm kind of jumping ahead, but definitely stress, medications. So, like any prescription medication, there's always a depletion of a nutrient, no matter what it is, whether it's over the counter or prescription. It depletes something, like birth control depleting B vitamins, and all that's indirectly, right? We need all
Mhm.
that nutrition to build a strong gut lining. So yes, there's so many different little ways
Mhm.
that can create leaky gut. It's really hard to pinpoint, to be honest, of like, okay, well, why do I have it? It's
Yeah.
possibly a combination.
That's right, yeah, and I wanted to sort of make that clear because I think sometimes we feel like if we just fix the diet, that can help, and it does help, but if we're not fixing, like you said, stress, because we do produce hormones and we produce stress hormones, which can affect, not only our digestion, but our sleep and other things as well. So,
Definitely.
yeah. So, what are the top foods that you think would influence good gut health if we're looking to kind of repair our gut through nutrition? What are some top foods that you would recommend?
So another, I guess, a trending thing is bone broth for sure.
Yeah.
Bone broth, and I would say good quality proteins. I mean, it's kind of all in one. But these proteins, and they're in bone broth as well, has these essential amino acids that we need to help support our gut lining. So you'll probably hear me repeat that a lot. It's supporting our gut lining. So
Mhm.
glutamine, arginine, glycine, lysine, all those are amino acids that just is vital to keeping those gates and those junctions tight and regulated. I do love bone broth though, because it's so easy to digest, especially if you're struggling with underlying infections, or just not feeling good digestive, always bloating, just you name it, even parasites, things like that. Bone broth is so great to really minimize the amount to quote unquote digest, versus like a good chicken breast or grass fed steak, and all that is essential too. But bone broth is just so gentle and easy on the stomach. And I think we know that from like our grandparents, like when we'd have stomach bugs and stuff, it'd always be like liquids and broth and stuff. And I think that's where that came from. So bone broth and proteins are definitely number one, but also veggies, because this provides our gut with prebiotics. And this probably more includes like cooked and cooled potatoes, because that is called a resistant starch. So basically, probiotics are there to feed your bacteria. So they're just little guys in our gut, and just like we have to be fed, they have to be fed for them to grow and become stronger, because there will always be the need for a balance in our gut. You will always have bad bacteria and candida, and you'll always have good bacteria. Well, hopefully. And so just more of what we need to focus on is we're not going to be ever able to just totally wipe out bad bacteria and all the candida, but just to create a balance. So we just definitely want to feed them. And so with that, I love using like the starchier veggies, like I said, cooked and cooled potatoes, sweet potatoes, squashes, things like that. But broccoli and all these different kinds of veggies with fiber, they just provide our gut with, the fuel that they need, as well as, oh my gosh, I'm going to butcher the word. Starts with a B, pyruvate, I think.
Yeah, okay.
I think that's it.
Yeah.
If you know me, I'm the queen at butchering words. But that feeds our colon cells as well. And so that's a short chain fatty acids. So when our gut, with the bacteria in our gut, the good guys, they make short chain fatty acids. And those, of course, have like health benefits in general with feeding colon cells, reducing, the risk for like colon cancers and things like that, but also influencing metabolism as well. So all that stuff kind of comes into play.
This is really interesting. And I think it's important to note what you just said about the starchier vegetables too, because I think sometimes, there are so many people like on a ketogenic diet or, trying to be so low carb. And I often wonder, is their gut health affected by that? Because of the things that you're mentioning. Now, if you're, I think there's a difference between eating like a clean ketogenic and I think Dr. Axe came up with that term, clean keto and dirty keto, meaning that like in a clean keto, you are incorporating vegetables. And so you did mention things like broccoli, which would be considered more low carb, but I do think that those starchier vegetables are beneficial for our bodies, like in the way that you just mentioned. So that's really important to note, I think.
Yes. I think that we're a society that always wants to jump to extremes or finding the magic pill. And right now that's keto. And honestly, I think the diet that's up and coming is a carnivore diet. I'm seeing so much of it. And I actually do have a friend that, a doctor friend that does it, and he's amazing. And he actually does lab tests and shows, just being on a carnivore diet, and actually his inflammation's awesome. And his gut bacteria is even awesome. I can't say that there's been long-term studies on what a carnivore diet looks like for the bacteria. But so it's very interesting. I just feel like sometimes we're always so drastic with it. Not saying that if you decide to do that you're silly. I'm not saying that, but I just find that I feel like just a balanced approach will always be where it needs to be. I don't know why we always have to jump from like absolutely no fat to now we're like absolutely everything fat. I'm like, what? This is like silly.
Exactly. And you have to think about sustainability too. I mean, can you do that for the long haul? It's one thing to try to lose some weight, or if you're trying to balance blood sugars, but if you're looking at the long-term life, I don't know if eating a carnivore diet is something that, you can do forever.
Yes. So, and I think too, it depends on bio-individuality of what works for you, because one diet works for someone, it doesn't work for you. So yes, there's tribes around the world that literally eat raw meat, like straight from the animal, not even cooked, but that doesn't mean that that's going to jive with everyone. So we, again, have to look at our individual needs and wants.
That's right. Right. And like you're mentioning, tribes in other parts of the world, they've probably, their gut microbiome probably has been adapted to living in that way. So it is different. Yeah. Now, what are your thoughts? I didn't tell you I was going to ask you this, but what about collagen? What do you think about that for gut health?
I do love collagen. So that's basically in bone broth. So that's why, I don't consider collagen a food. I consider it more of a supplement, I think.
Supplement. Okay.
Because collagen is in bone broth. But again, it still provides you with those amino acids that you need for good gut health. And then, of course, your hair, skin, nails.
Yeah. Yeah, right. Exactly. I'm a big fan of collagen, but I have noticed, and I've mentioned this several times, that I've noticed a huge difference in the thickness of my hair. from taking it, but I do love it for gut health too, which leads me to my next question. So what are your favorite supplements for leaky gut in addition to the collagen?
Yeah, so definitely collagen, L-glutamine too. And some people, especially if they're struggling with digestive issues, really need a concentrated amount of L-glutamine. So L-glutamine powder is very common when you're doing like a gut protocol, just supporting your gut. Quercetin as well, which is naturally found in like apples and stuff. But this also helps support the gut lining, closing up those tight junctions. Along with digestive enzymes are very helpful for people that just really need help digesting. So with my gut protocol that I do, digestive enzymes are a big part of it because I really just want the digestive system to quote unquote rest as much as possible, make it really easy to like digest the foods while the rebuilding process is happening. Marshmallow root tea is also fantastic, supporting the mucosal lining as well. And it's also really great for sore throats and anything else that you feel like you need to support the mucosal lining. Marshmallow root, though, needs to be in a tea form. So I know that there's supplements that are in capsules, but in order to extract the benefits of marshmallow root, it needs to be soaked in water and consumed as a beverage, not a like capsule supplement. And then SBI Protect by Orthomolecular is one of my favorite supplements because this helps bind the toxins within the GI tract. And that one, I think you have to order through a practitioner or clinician like myself or a functional medicine doctor or something. I don't think you can get that like on Amazon or just in Whole Foods or something like that. But
What's the name of it? I'm sorry, I missed that.
SBI Protect.
SBI.
And it's by Orthomolecular.
Okay,
it's
thank you.
fantastic. And I do love that because since the whole part of it is to bind the toxins in the GI tract, just really supporting a microbial balance in your GI. And then probiotics, which I know is a question that one of your tribe asked. And I do think probiotics are necessary. I don't think that they need to be a forever thing. And I know some people, I think, just go ahead and put probiotics in their routine. And this is like, just like a multivitamin, like I take it every day. But I feel like it's a great starting point if you need to, depending on where you are, depending on what you're struggling with. But then hopefully, one, we either eat more fermented foods, which our ancestors did do, or we just, help build up that bacteria in our gut. And then we are able to sustain them with, having a good diet. And so I've seen that for myself as well. As I took probiotics for a couple years pretty regularly. I really honestly haven't had any GI issues. I just kind of took it, right? Because it was just like, I don't know. I don't eat fermented foods, so I probably don't have good gut bacteria. But I haven't been taking them, honestly, for the last 6 months. Maybe once in a while, or if I'm feeling like I'm coming down with something or something like that. But I just did my stool test back in January, and my bacteria was amazing. It was popping. It was awesome. And so I am now feeling like I don't think there are very high levels of it. So I don't feel like I need it. So I don't think we need probiotics forever, but I think it's definitely a good starting point. One of them, which I know a lot of the questions are well, which probiotic? Because we want to help it provide the GI really, the acid in our stomach. And something that I feel like definitely is booming right now, with good measure, is spores. And so it's by Microbiome Labs, Megabiotic. I use it all the time, and I'm blanking on the name of it, which is really weird. But there's also one that you can buy. That one you have to get through a practitioner. But Just Thrive, you can get on Amazon, which is a spore biotic.
It's funny that you said that because I had heard about Just Thrive on another podcast, and so I ordered it. And I think that that's pretty interesting. So the understanding about spores is that it spore-based probiotics is that it survives past the acidity of the stomach, and because it's encased in the spore and then is released in the small intestine. Is
Yes,
that correct?
it's like
Okay.
it's known as like a seedling. So it's supposed to,
Okay.
yes, bypass it and then be a seedling in your microbiome. And then obviously,
Okay.
it blooms and you have good bacteria and things
Yeah.
like that. So honestly though, I've seen really great like not with me, but like with other practitioners that use it that have
Okay.
seen really good health benefits and just good overall like health support as well. Because like I said, the majority of our immune system's in our gut. So we need to make sure that we're supporting that as much as possible with like nutrition and supplements where necessary.
Yeah. And that's interesting. I really like what you're saying is that, that probiotics can help it, but you don't have to be on them forever, which is kind of, it's kind of refreshing in a way because, I think we can shell out so much money on supplements sometimes. And if we think we have to be taking probiotics, and they can get expensive depending on what you're taking. But it all comes back to nutrition anyway, right? And making sure that we're getting those prebiotics and feeding our own good bacteria in that way,
Yeah,
and the in between times. Yeah.
definitely.
So, what's your take on food sensitivities and how they play a role in gut health?
So I think food sensitivities are really important, but I know that there's so many tests like on the market. They're like $99, find out what your food sensitivities are.
Mhm.
But a lot of those are only testing IgG, which is one immunoglobulin of our whole immune system. And just because our IgG is increased does not mean that we have a sensitivity to the food. What we want to
Mm.
look at when you're testing food sensitivities is you want to look at the inflammatory mediators. So that's your histamines, that's your interleukins, that's your cytokines, among others. Those are just a couple. So with food sensitivity, I use the MRT panel in my practice, and that is actually testing these inflammatory mediators. They're not testing the IgG, which is every other food sensitivity test out there, because I find that you'll get false positives and false negatives when you just look at that. So you actually want to say which foods are actually literally producing inflammation in my body. And so with this, especially with food sensitivities, it's causing inflammation. So we want to definitely diminish the inflammation when we're doing anything GI, but also with bloating. So with food sensitivities, if your inflammation is up, this is going to help make you retain water, leading to bloating, leading to weight, weight gain, I guess,
Mhm.
along with when we eat foods that just don't jive with us, it can produce the excess gas, making us have that belly bloat as well. So that's kind of how they're, kind of together. But with food sensitivities too, you have to think this is where bioindividuality comes into play, because I just tested one of my pediatric clients and she was highly sensitive to salmon. And then
Mm.
another one that I did was cane sugar and dairy, which is kind of common, not cane sugar, but dairy. And then other people are like strawberries and blueberries and sweet potatoes. And so it's really interesting because as a nutritionist, we talk about eating wholesome foods, and these are all wholesome foods. But for that individual person, that food is not ideal at the time, because food sensitivities can
Yeah.
change. So definitely food sensitivity, knowing what you're sensitive to helps, because we want to, as much as possible, lower the inflammation in your body.
That's really interesting. That was my next question, is that can they change? Because I actually had the MRT test taken, but it's been about 4 years ago. It was right after my youngest son was born. And it is interesting what comes up because, like you said, it was not things that I ever would have thought. Like I was really high histamines, and reaction. I was in the red, I guess you would say, for salmon and hazelnuts and tea. And there were some things that, and oranges, just
Wow.
things that yeah. And I can't remember all of them right off the top of my head. But yeah, it was pretty interesting that some of them were foods that I didn't really even eat that often. Like I'm not really a big tea drinker, but it showed that it was inflammatory. But I just wondered how often do you suggest that people be tested if they're having any kind of issues?
So the idea is behind, like with MRT, is like you have green, yellow, and
Mhm.
reds, and the lower green you have is you're supposed to be on that for a period of time, and then I think it's like for any like really red foods that produce inflammation, at least 6 months before you even try challenging that. And as gut health changes, and I feel like it's better, your ability to handle, a food that was inflammatory gets better. And so, yes, food sensitivities do change. It's not for everything like allergies are. But it's definitely vital to know, well, what do you need to even take out in the first place?
Yeah, exactly. Do you order any other labs for gut health besides MRT?
Yes. Let's see. I definitely do the comprehensive stool analysis, and all these labs too. I highly recommend taking to your doctor, just because I'm not a doctor. I can't diagnose and all that good stuff, which I don't want to. So take them to your doctor. But
Yeah.
what I can do is that I can definitely see where I can support you with nutrition where I can. But the comprehensive stool analysis, which there's a couple, GI map is really popular, which I do like, along with comprehensive stool analysis by Doctors Data. That's another good one. And so most of the comprehensive stool analysis that you can get, it is testing bacteria balance, it's testing yeast and parasites, along with, I think the GI map tests viruses even. And then digestion markers, which is very essential to see, like, are you even digesting properly? Along with inflammation markers and some other like odds and ends stuff. But it's a really good test to just get a feel for how your GI is. And I think most people, I feel like in the functional medicine realm, probably recommend the GI map as of now. I feel like that's a really common test that people are loving.
Okay. Yeah. Thank you. And you're able to order those, right?
Yes, yes.
Okay.
But yes, I always recommend, like, even though I
Yeah.
order them, and I mean, we can look at them, definitely take them to your doctor, because I don't know, it's that collaborative, effect with your doctor and your nutritionist, and some people even have health coaches and stuff as well. And so kind of, I feel like that's the best healthcare, is when we're all like working together, and, doing what we are, I guess, good at, because we all have
Yeah.
different strengths.
Yeah. Very, very good. Yeah. I totally agree with that. So you, outside of food, you had mentioned other lifestyle factors that could affect gut health. You did mention prescription medications that they could deplete nutrients in the gut. Are there any other lifestyle factors, that we need to be aware of for gut health?
Basically, yeah. So medications, stress and sleep kind of go hand in hand, like I was talking about with the high cortisol, dysregulating our immune system, so we become more susceptible to infections. Along with sleep, I say stress and sleep together, because when we don't get enough
Mhm.
sleep, we're stressed. So those
Yeah.
kind of go hand in
Yep.
hand,
Mhm.
along with just environmental toxins. So like, pesticides, along with everything else, because again, everything, like what we put on our skin, all of it just goes together. It all gets absorbed. It's all something that our liver has to detox, and then we excrete.
Absolutely. Right. So then lastly, how are hormones affected to our gut health? This is probably very interesting for a lot of our female listeners. We want to know how, if we have poor gut health, how that could affect, in general, our reproductive hormones and other hormones, maybe even thyroid.
Yes. So hormones and gut health is really interconnected. And it's so funny, because people, when I have clients that come in and they're like, I struggle with X, and, they're trying to get their diet better. And then I'm like, well, like, I start asking GI questions, and they're like, why are you looking, or even asking like about my poop or whatever? And it's like, we're talking about hormones. But because depending on our gut health, there is an enzyme that's produced in the gut called beta glucuronidase. And so at high levels, which is kind of common if you have an underlying infection and gut issues, we can produce this at high levels. And so when we do that, there's obviously a way of how we detox and excrete our estrogen. And the last phase of the detox process of detoxing estrogen is pooping it out. That's how we get rid of it. But with this high level of this enzyme, it breaks open the little packed up estrogen that's getting ready to be pooped out and detoxed and excreted from your body. It unpackages it, and it basically allows our body to reabsorb it. And then now we're getting into the possible estrogen dominance issues, which is where endometriosis comes in, along with many, other symptoms or issues. So that's definitely a high correlation between gut health and hormones. And with hormones, again, it's all about balance. When one hormone is out of balance, whether that's your estrogen, whether that's your thyroid, whether that's your progesterone or your cortisol, everything else just kind of can fall down. It's a domino effect. And so that's why we always aim for balance with our hormones. So anytime if we're having estrogen dominance, your progesterone might be affected. And when your progesterone is affected, it's going to affect this and all that. Along with, I kind of mentioned the high cortisol as well. So our high stress hormones that can definitely hinder our gut health and the ability to keep it functioning properly. So among other things, everything's interconnected, and I feel like we can go down this deep rabbit hole of like a chicken or egg type of situation.
Right. Exactly. And I think that's the important thing, that it's all very interconnected. So, I think it's like you keep saying the word individuality over and over again. And I think that that's so true, because there's not a one size fits all for diet or for managing stress, but also just, paying attention to your body and how you're feeling. And if you're having issues with digestive health, you mentioned leaky gut it doesn't have to be just digestive health. It could be things like eczema and autoimmune conditions. So,
Yes.
If you're experiencing things like that, it's important to take a look at your gut health too. Maybe get the food sensitivity test that Lahana was talking about, perhaps even doing a stool test. So those things aren't just for, if you're bloated and constipated.
Yes.
Gut health goes well beyond that. So.
Yes, even like depression, anxiety. I mean, so many things are connected to the gut, which is why, again, you get the looks of like, why are you looking at my gut? I'm just anxious. But all of it just plays all together. And it's so important to whatever symptom you're having. It's just kind of, reassessing, like, should I be looking at my gut? Because if you are, because I think it's also really easy to put a Band-Aid, like a natural remedy, a supplement, even though it's natural, as a Band-Aid on like the real issue. And so that's why I'm always like digging. It was just like, you definitely want to find out what's wrong. And so again, working with a doctor, definitely finding a functional medicine doctor or nutritionist, and just kind of having that tribe of yours to be able to find out what works for you, as well as, getting to the root cause of everything.
Awesome. Well, Lahana, thank you so much. You're such a wealth of information. And I so appreciate you being on the show and explaining this to us. And you made it in very understandable terms. So we appreciate that so much. And if people wanted to reach you, what's the best way for them to contact you?
Awesome. Thank you so much for having me. It was so much fun. I love chatting with you. The best place to find me is Facebook or Instagram at Thrival Nutrition. So it's THRIVAL Nutrition, as well as our website, thrivalnutrition.com. Probably are the best places to find me. I'm always on either one of them. So if you want to inquire more about getting tested, or just, some people just know, like, I really need to clean up my diet. Like, I really just need to, take this healthy living to the next level. We are here. As I said, we have a team of dietitians and myself and health coaches to kind of help people through whatever season that they're in.
Okay, great. Thank you so much, Lahana.
Yes.
Thanks so much for being on the show.
Thank you.
That's it for today. For more from Kim, you can go to kimmaravich.com. For more from Lori, go to simplyempoweredllc.com. We're always open to listener questions or suggestions for the show. You can email those to contact@awholenewyoupodcast.com. We'd also love it if you joined our Facebook community and followed us on Instagram. Just search for A Whole New You Podcast. And lastly, if you'd be so kind as to leave us a review in iTunes and subscribe to the podcast as well, we'd really appreciate it so more people can find our show and join our community. See you next week.